Graphites is one of the antisoric and deep acting remedy as carbovich, carboanimalis, and carbon sulf. Among all carbons, carboanimalis is very good in as an antisoric also, and as in the chronicity which is arising from venereal disease. So that is the difference of carboanimalis from all the carbon. Whenever you want to prescribe it is, you have to see the discharges. And I think majority of prescription has been done on the eruption and discharges. Whenever homeopath finds eruption, they will prescribe graphites. But the very characteristic discharge of graphites is that is inflammatory. The inflammatory discharges are albuminous sticky discharge. Have you ever seen honey? You will appreciate the discharge of graphites. Raw surface on the skin, and you will find this type of discharge. And you will see in general pathology, ulcers, the inflamed tissue, and old cicatrice more indurated at the base. Again, you will see all this in other carbons also, but there would be a big difference. That is the discoloration which which shows, carboanimalis shows, you will not find much in graphites. So again, ulceration which is indurated and burning at the base. One of the good remedy for cancer. Again, like carboanimalis and carbon sulf. It will restrict the growth of cancer. Whenever you are thinking of palliation and there is a glandular swelling with purple, you think of carboanimalis. And carboanimalis is one of the good palliative remedy. And for restricting the growth, the remedy are graphites, carbon sulf, and calcareous sulf. People who follow or prescribe Calcutta method, they will frequently prescribe graphites on seeing a old scar or a cicatrized condition of skin converting into cancer. Weakness, they are extreme weak and desire to lie down. This is common to all carbons. Second very common aspect of carbon and graphites is weakness of muscle and tendon. And this weakness is because of overstraining and overlifting. And this is common to all, that is carbovich, carboanimalis, carbon sulf, and graphites. You will find these things in all the four remedies. But very characteristic which is found in graphites is contraction of tendon, especially behind knee. So we are talking about weakness, so we can think graphites is one of the good remedy for paralytic condition also. So range of graphites is, you can see how general pathology, general understanding of graphites is. So we'll see paralysis, any part, especially lower limb, the paralytic sensation, where you will see paralytic condition creeping in body slowly. So this will present weakness slowly all over the body. Cataleptic conditions where patient is conscious, not move and can't speak. Sometimes you will see hysterical affection of graphites in this way. I was called at home. Lady was very stiff and unconscious because there was some quarrel going on in the house, and she was so frightened that she became stiff. और जब उसको उठाया गया ना, तो ऐसा लगा जैसे वो लकड़ी है, जैसे लकड़ी बैंड नहीं होता है ना, वैसे she was not bending. She was bit conscious but was not able to speak. Because of fear she went into that state. और जब उसको उठा के लेके गए, and the doctor told that she was under the influence of fear, having an hysterical attack. So there is a rubric like grief, constant, and chronic. This is the rubric in which graphite is only one remedy. This gives you the understanding ki how grief develops. And in this case, you will see ऐसा grief अगर लेकर graphites आता है ना, तो you will tend to prescribe IGN. So IGN will come very closer. IGN is recent grief, and graphites is constant and chronic. This is very important. We have seen graphites anxious. We have seen graphites who is abnormal anxiety for disease will understand the grief part, sadness part of graphitis. And this sadness develops because of long duration of grief, traumatic condition of life. So frequently I have seen many cases in which after that person suffering from grief for a long time, someone has died in house and person is suffering from grief for a long time and then converted, then she can develop a symptom of graphitis where she will become very anxious about how the future will be, anxiety about business.
A patient aged 23 came with the complaint of bleeding from the nose, and it started with a headache. And in the headache, she explained that she would feel hot-headed, and an unbearable pain. The patient was described. He was a very sensitive person. So what the patient had said was, I had a very good childhood, a good life, and nothing was bad or unpleasant. I was a little sensitive when I was small. I cried when my mother went to the native place. I also get easily hurt if someone says something bad. If I do some work for anyone, they react. And being in the office and I'm not appreciated, I do not like it. She feels that she does so much for others, but no one cares and she feels hurt. She visited a specialist for the headache issue and they said that you have to avoid sun to get rid of it. And she said, I stopped going out of the house for 2 to 3 years. And as a person, I am very nervous. After 2 to 3 years, I went for a wedding and I felt very nervous as if everything was new. I was unable to talk to people and was very nervous while talking. My grandmother asked me what had happened. I just broke down and I started crying. Whenever I break down like this, I feel better. My nervousness is also better after weeping. Whenever I'm anxious, I feel like crying. And if any friends come to my house, I get very tense, very nervous. How things will go. Whenever I read anything, I feel very tired. I cannot concentrate, weakness of my mind, and I become very dull.
You will find in this case, the patient is very sensitive. As I said, they are very anxious also. You will find offended easily, very easily in graphitis. So this case, you will see ki a oversensitive person who avoid going out for 2 to 3 years, and when she came out, she was very nervous, and that nervousness has led her to feel everything new. You will find that delusion strange everything is, and she was very anxious and was unable to talk. So while talking, she used to get nervous. So you'll find in graphitis nervousness, they will have an excitement. They will get excited, nervous excitement while talking. In this case, we have taken rubric like timid, public, about appearing in, offended easily, concentration difficult, and weeping. Now we will understand the smaller part of this case and understand graphitis. She has become very nervous, anxious, and she weeps in anxiety. So you'll find graphitis easily weeping. That's why it comes very closer to pulsatilla. Weep very easily. Now pulsatilla will weep because they are emotional and sad. Graphitis, they weep because of anxiety and as well as sadness also, but prominently they are very anxious. But whenever graphitis will cry, they will feel better.